During this presentation, I'll be discussing the ethical controversy of the Northfield Laboratories Polyheme Trial. This is a phase 3 clinical trial that occurred between the years 2003 and 2006.
Posted it and then realized I posted it on the wrong platform.
So what was Polyheme? Polyheme was a hemoglobin-based oxygen carrier that could be used in life-threatening emergencies when blood products were not readily available. And that's from Moore et al. 2009. This Polyheme could be stored by pre-hospital providers much more easily than blood products, and the goal was to reduce mortality rates related to hemorrhagic shock in trauma victims. According to Eastbridge et al. 2019, hemorrhagic shock is the leading cause of death in trauma patients across the nation. It is important to note here that Polyheme is not a blood product alternative. It is a hemoglobin-based oxygen carrier. It is not an alternative to a blood product. The Moore et al. 2009 study enrolled 714 trauma patients across 29 facilities who were experiencing hemorrhagic shock. This trial had FDA exception from informed consent due to the emergency nature of the Polyheme administration, and that can be found with the U.S. Food and Drug Administration 2013. This meant that they were on an opt-out type of consent instead of informed consent for each person. So the community members had to inform pre-hospital providers that they did not want to be a part of Polyheme, and if they did not tell them that, then they were automatically going to be part of the randomization. So what was the controversy here? Polyheme was administered by the pre-hospital providers where blood products were not readily available. However, once they reached the hospitals, the patients who were given Polyheme remained on Polyheme. Thereby, blood was withheld, which is the standard treatment for hemorrhagic shock. So according to the Belmont Report, 1979, the risks should be minimized and justified in relation to the anticipated benefits and knowledge acquisition when conducting a human subjects trial. So in the Polyheme trial, one, the patients could not necessarily refuse to participate. They could not withdraw their consent at any point. When randomization was occurring, this was during a very vulnerable period for the patient. They were injured, hurting, scared, and the experimental treatment continued to be given even after a standard proven treatment became available. So once they reached the hospital, the question became, was the emergency exception adequate protection for a patient who could not fully advocate for themselves, especially once standard treatments became available? So what additional principles were challenged? So we have respect for persons. Again, the patients were enrolled with the emergency exception from consent. However, they could not withdraw their consent, readily withdraw their consent. They were offered blue armbands. However, there are some reports that state that the informing of the community was very limited and people were not aware of the armbands. Beneficence is where the researchers would have to prove that the benefits justified the risk, and in this Moore et al. 2009, they were not able to fully and adequately prove that the benefits would outweigh the risks because of the experimental nature. With non-maleficence, the experimental nature of this drug exposed critically ill patients to additional harm. In addition to that, standard blood products were withheld from patients once they reached the hospital. The final principle that was challenged is justice. So the patients who could potentially receive Polyheme were the trauma patients, and these were patients who were significantly injured, thus making them a highly vulnerable population. So with all of this, was research valuable? Yes, this was a phase 3 clinical trial that addressed a very legitimate concern with an innovative solution. According to Moore et al. 2009, their goal was to reduce mortality related to hemorrhagic shock by offering a pre-hospital solution to help stabilize patients with massive blood loss. However, the results of the study showed that Polyheme had an increase in the number of adverse effects compared to blood products and an insignificant reduction in the use of blood products. So the FDA did not approve Polyheme. So what did we learn, and how does Polyheme influence research and nursing education today? This trial highlighted the importance of safeguards on emergency research and emergency consent, such as clearly stating the risk versus benefits for the populations involved, evidence that the available treatments are unsatisfactory at all point in time, and community consultation, so informing the community of the trial starting before it starts, risk versus benefits of that trial, and informing them of ways to opt out, withdraw their consent at any point, and informing them of the results of the trial after it has concluded. For nursing education, we need to remember to teach our student nurses that part of the nurse's role is advocacy, even in ethical situations. They should be encouraged to ask, what are the risks versus benefits for my patient? What can this patient properly consent? And is there any alternative treatments available for my patient? Here is my list of references. Thank you.